Hey guys, so today's video is going to be about thoracic aortic dissection. An aortic dissection starts with a tear in the inner layer of the aortic wall of the thoracic aorta. This is a life-threatening emergency. It most commonly occurs between the age of 50 to 70 years. The risk factors include hypertension, Marfan syndrome, bicuspid aortic valve, coarctation of aorta, aortic aneurysm, smoking. There are two types of aortic dissection. One is type A, which involves the ascending aorta or arch in 70% of the cases, and type B, which is the rest of the aorta in 30% of the cases. Symptoms include sudden tearing chest pain radiating to the back, dyspnea. Less common symptoms include congestive heart failure, fainting, stroke, ischemic peripheral neuropathy, paraplegia, so for diagnosis, transesophageal echocardiogram or TEE should be done. One can also do a computerized tomographic scan of the chest and magnetic resonance angiogram MRA. The treatment includes a beta blocker to lower the systolic blood pressure to around 100 mmHg. Emergency surgery is the treatment of choice for type A. As much as possible, the dissected aorta is removed and a synthetic tube or graft is used to reconstruct the aorta. Medical management may be considered for type B as it's usually not very severe. So hope you like my video. Please subscribe to my channel and I would be inshallah coming up with more such informative videos. Okay, thank you. Allah Hafiz.